get more on this data from Discovery Health. They've revealed what seems to be the first large-scale data in South Africa about the impact of the Pfizer vaccine on the Omicron variant. It shows that the Pfizer vaccine gives you 70% protection against severe symptoms of COVID-19 and around 30% protection against being infected by the virus. In other words, 70% chance it stops you going to hospital. Dr. Marvin Hsiao is an associate professor and consultant virologist at the UCT Groote Schuur complex of the National Health Laboratory Service. Professor Hsiao, good afternoon to you, and I really do appreciate the time. So, Discovery has a large number of members. They did this on 211,000. A figure of 70% protection against severe illness. That seems to be a very important figure. Is that what you were expecting?
Yes, I think since the emergence of Omicron, I think the various kind of researchers in South Africa has been gathering similar data from different, using different approaches. And one of the kind of more advanced kind of data, which are more comprehensive data, obviously come from the private sector, where these information are collected more thoroughly. And Discovery's data certainly is one that we always kind of keeping an eye very close on. And I'm glad that they have reported their, what I consider kind of the early kind of interim data on Omicron. Yeah.
We know that Pfizer gave over 90% protection against the Delta variant. The fact it gives 70% protection against Omicron, I mean, should we be disappointed by that? That's still quite a lot of protection.
Yes, I think this is still largely reassuring. I mean, we would obviously like to see that a much higher protection against hospitalization. But at this early stages, we need to also keep an eye on the outcome of these hospitalizations to try and properly understand what this means. But the reduced efficacy or effectiveness of the vaccine against hospitalization probably reflect the fact that there is a much greater force of infection, and this is kind of resulting in individuals that previously not infected are now being having either breakthrough infection or reinfected, compared to the Delta wave in the previous in the third wave.
So this is where it gets quite complicated, as I understand it, because so many people have been infected before with other waves of the virus, and so many people are vaccinated, so many people have had the virus, been exposed to it, and been vaccinated. Does it get quite hard to know if it's the previous exposure to the virus which is protecting us, or if it's the vaccine which is protecting us?
Yes, I think one would expect both. And one would expect in some individual there may be even a combination of both past infection and vaccination. So what we can see is that there is a great level of escape from any form of prior immunity against infection. So that is quite clear, because we just came off the third wave, where a large proportion of South Africa have been infected, and the vaccination rate has been growing this whole time. So it's difficult to know exactly the numbers which are due to past infection and which are due to exactly vaccination. But the bottom line is that the kind of prior immunity against infection is significantly compromised, against Omicron.
It also gets quite complicated because some people were vaccinated very early on. So older people were vaccinated from May this year, whereas younger people were vaccinated much later. Does that also sort of skew the figures a little bit one way or another?
It does, and then particularly important when it comes to interpret the kind of the protection that we see. And then, if I understand correctly from the Discovery data, in the older age groups, the protection is somewhat less when compared to the younger age groups, and that probably is partly due to that the older individuals had their chance of being vaccinated early on, and then therefore greater time has lapsed since the actual vaccination, and therefore the protection against both the infection and partly the hospitalization would have waned somewhat.
I presume there's a huge amount of research on this going on around the world. It won't just be Discovery, it won't just be in our country, it'll be in other countries. Some of this research will be by governments. Do we yet have figures there? I know Omicron, of course, came I realize to say where it came from is very contentious, but it was first discovered by scientists here. So am I right to suggest that this will be some of the first data anywhere in the world?
Yes, it is among one of the earliest data, and that's mainly from the point of view that we are kind of exposed to the kind of brunt of the early infection first. But I think the data is also starting to come out from the UK, where the number of cases are growing, and there the system of collecting information is also reasonable. And there are some preliminary data, but then in the next couple of weeks, when we have accrued more actual outcome among those people who are infected, I think those data will also kind of start to kind of support what are the differences between what is seen in other countries that are highly vaccinated versus what we see in South Africa, where we have like a reasonable blend of immunity from past infection and from vaccination.
And the Johnson & Johnson vaccine, no one seems to be talking about that. Some of us have a personal interest in the Johnson & Johnson vaccine's efficacy because we were injected with that. Has anyone done any work yet on how effective that is against this variant?
I think that also is kind of being monitored on an ongoing basis. And then again, there are like various different groups and researchers in South Africa that are looking at that. And one of the important groups, obviously, it's among the healthcare workers. I think the data is not yet available, but the work is ongoing.
Dr. Marvin Hsiao, thanks very much indeed. Professor Hsiao, I should say, an associate professor and consultant virologist at the UCT Groote Schuur complex of the National Health Laboratory Service.